starts.
Okay. All right. Good day, everyone. Welcome to the February edition of the UIC Global Health Colloquium. I am Rohan Jeremiah, Associate Professor in the College of Nursing, as well as Interim Associate Dean for Global Health. I'm very pleased to welcome you guys to this lecture series. Once again, it's co-sponsored by the Colleges of Medicine, Nursing, Applied Health Sciences, Pharmacy, Dentistry, and Social Work, along with the School of Public Health. Just a quick reminder, our next session is going to be March 1st, a Wednesday, and more information will be released to you. I'm excited to introduce one of my colleagues here in the College of Nursing who is going to be talking about her work on LGBT health in the Arab world, the case of Lebanon. Dr. Sarah Abboud research centers the intersections of ethnicity, sexuality, gender, health, immigration among immigrants, ethnic minorities, and sexual minorities in the United States. In particular, she works with African Arabs and Arab Americans in Lebanon, and her work is informed by social justice, intersectionality, and health equity frameworks, and aims at decreasing the health disparities faced by marginalized populations. Along with her research work, she has extensive experience in sexual health, qualitative research methods, mixed methods, and community-based participatory research approaches as well. Dr. Abboud completed her BS and MS in nursing at the American University of Beirut School of Nursing in Lebanon, and her PhD and postdoctoral fellowship at the University of Pennsylvania School of Nursing. She's currently an assistant professor here at UIC's College of Nursing, and particularly in the Department of Human Development and Nursing Sciences. Before I hand it over to Dr. Abboud to present, I do want to let folks know that there is a chat feature in this presentation. So if you have questions that you'd like to pose to Dr. Abboud after her presentation, we'll be taking those questions in the chat feature. So welcome, Sarah.
Thank you so much for this introduction, but also for inviting me to give this talk. So my name is Sarah Abboud. I'm here at the College of Nursing, and I'm really excited to talk to you about some of the work that I have been involved in the last several years around LGBT health, specifically in Lebanon, but I will also give an overview of the Arab world. I will be sharing my screen. All right. So just a quick overview of what I will be covering today in the next almost hour. I will go over some terms and define them specifically for you to know what language I am using around some of these terms that have multiple definitions, especially not knowing who is in the audience today. I will do a quick overview of LGBT health in the Arab world or Middle East, North Africa region. Brief overview of the historical perspective of Lebanon, and focus specifically on LGBT rights, laws, practices, and health, and then talk a little bit more on the work that I have been involved in with the LabMash, which is Lebanese Medical Association for Sexual Health, that I'm a board member of. So it's mostly community-based work and advocacy around advancing LGBT health in Lebanon specifically. So LGBTQ stands for lesbian, gay, bisexual, transgender, queer, SGM for sexual and gender minorities. I will be using these terms sometimes interchangeably, but this is what I am specifically referring to. The Arab world or Arab countries include countries that are defined as countries that speak Arabic. And based on which definition you use or which organization or entity you use their definition, this could include anywhere between 18 to 22 different countries. The term Middle East and North Africa is a very colonial, political, and contested term. It has no standardized necessarily definition. Again, different organizations like the United Nations, World Bank, World Health Organization, they have different definition of that, of this territory, and some do not even define it as a region at all. I will be using the term MENA, even though it is very contested, because it's one of the most commonly known terms, especially from a Western perspective. A more appropriate term that is more a geographical term is SWANA, which is Southwest Asia and North Africa. I would like to introduce that term, and there has been a lot of movements to use this more appropriate term. However, for today's presentation, I will use MENA. And again, based on which definition you use, this could include anywhere between 22 to 24 different countries. So geographically, the region in the darker gray is the region that I will be focusing on. So it stretches across North Africa, part of Northeast Africa, and Southwest Asia. So the most inclusive definitions include all of these 24 countries. So briefly, the minority stress theory conceptualizes that excess stress to which individuals from stigmatized social categories are exposed to as a result of their social, often a minority position. These stressors are unique in that they are additive to the general stressors that are experienced by other people or all people, and therefore require adaptation above and beyond those required by non-stigmatized or marginalized individuals based on their social categories. They are also chronic in that they are related to relatively stable social structures such as laws and social policies that exist in our societies. And they are socially based in that they stem from our social and structural forces rather than individual events or conditions. And so the health disparities that are observed within the LGBTQ populations do not reflect, obviously, psychological or physiological issues that are inherent to LGBTQ individuals, but rather are the end results of persistent stigma and discrimination. And so these are like this, again, the three different levels of minority stressors that individuals experience at the structural levels, at the interpersonal, and at the individual levels. Stigma and discrimination could be experienced starting from someone's family, schools, friends, all the way to how media represents the LGBT community, to workplace, from colleagues, within the healthcare systems and by healthcare providers, and also within our systems that include police, jails, prisons, our laws and policies. And so some of the consequences of these stigma, discriminations, and violence are reflected in the poorer mental and physical health, higher rates of HIV and other sexually transmitted infections, and lower access to healthcare services that are seen among the LGBTQ community when compared to heterosexual, straight, or cisgender individuals. And so there's a lot of growing evidence that also shows the contribution of the healthcare providers to these disparities within the LGBTQ populations. And these are reflected in different factors. Some of them are the lack of training that we do not receive as healthcare providers in providing the appropriate and affirming care, and some of the discriminatory health policies that exclude or marginalizes further the LGBTQ community, direct experiences of discrimination, harassment, microaggressions by healthcare providers, inadequate medical systems like our electronic health records that are not inclusive, or the restrooms or the exclusive environment like the hospitals or clinic. In addition to inadequate communication that also leads sometimes to lack of preventive services or inaccurate diagnosis or treatment. And so this is a quote from the report on the IOM. Healthcare clinicians have been socialized in a society that stigmatizes sexual and gender minorities, and this context inevitably affects their knowledge and perception of LGBT people. And so most of the growing evidence has been published or reported from North America and Europe. And there are gaps in what we know about LGBTQ health in the Arab world or the MENA region. And so the region is a very diverse, complex, politically volatile region. And despite the increased visibility of the LGBTQ community, there are still a lot of barriers and human rights violations that affects the community in unique and complex forms at the intrapersonal, interpersonal, or at the structural levels. And so we still find, for example, many countries in the MENA region that still have laws that criminalizes same gender relationships or behaviors. For example, in Lebanon, Article 534 of the Lebanese Criminal Code states that any intercourse contrary to the order of nature is punishable with up to a year in prison. So this law is rarely enforced. However, when it is used, it is mostly used to threaten and criminalize LGBTQ people living in Lebanon. Similarly, in Egypt, there's felony Article 9 of the law that works on combating of prostitution. However, it has been used a lot to prosecute anyone who associates or is connected with the LGBTQ community. And so these create some unique health risks that are poorly understood. So recently, we've conducted a scoping review, systematic scoping review of the literature that looked at the health of sexual and gender minority individuals, specifically in the Middle East and North Africa region. And as I've seen earlier, Dr. Tawda Hughes is also on the call. She's also the co-author on this recently published article. So we really looked at identifying the literature related to the health of LGBTQ individuals, and more specifically to look at research gaps and priorities. Very briefly, we systematically searched PubMed, PsycInfo, CINAHL, and BASE, and we looked at combination of different terms for our region, so the Middle East and North Africa, and we used the definition that combined the World Health Organization and World Bank, which included 24 countries, and also multiple different terms to represent the population. And these were terms used in both health and social sciences disciplines. After doing screening, identifying what articles were eligible, we ended up with 98 articles to review. And so our results, not surprisingly, most of the studies, so out of the 98, 87 of the articles were published between 2011 and 2021. And 2021 was the date of our final updated search. And only 11 studies were published prior to that. So again, this reflects a little bit more of like the work that is being conducted in the last 2 decades around LGBT health and advocacy. Most of the studies were quantitative in nature. They focused mostly 47 out of the 98 on transgender individuals, specifically transgender women, and 36 out of the 98 focused on men who have sex with men. And few others looked at a combination of different individuals, and only one study looked at sexual minority women. Most of the studies used convenience or purposive sampling and followed by responder-driven sampling. So studies were only conducted in 10 out of the 24 countries, with the majority of the studies conducted in 3 countries that were Lebanon. So we had 33 studies conducted in Lebanon. Pakistan had 32 countries, and Iran had 23 countries. So 88 out of the 98 were conducted in these 3 countries, and then the rest were conducted by other countries such as Egypt, Jordan, one in Libya, and a few others. So we categorized the studies based on the main research objective or the main aims of the study. And we had more than half of the studies looking specifically at sexual health related outcomes. So 52% looked at that, 20% looked at mental health outcomes, 70% at gender identity related factors, 7% at violence and discrimination, and 2% on experiences with the healthcare system. So among sexual minority participants, as I mentioned, only one study was exclusively conducted with sexual minority, cisgender sexual minority women, and reported significantly younger age at sexual debut, higher number of lifetime sexual partners, or experiences of unwanted sexual contacts than straight women. And the remaining studies within the sexual minority participants were among men who have sex with men, which also most studies reported high number of sexual partners. HIV rates ranged up to from 0.4 to 12.3%. And then there were a lot of big ranges of findings based on related to HIV testing or STI rates or knowledge related to HIV and condom use. And these depended on the type of studies and where these studies were conducted as well. There was a consistent reporting of inconsistent condom use among the studies. And only one study looked specifically at PrEP use or pre-exposure prophylaxis for HIV prevention. Among gender minority participants or transgender participants, similarly, we saw high rates of HIV, but the ranges also were very wide, between 1% but up to 22%. HIV testing was low, and in most of these studies, the rates were less than 50% of their sample. HIV knowledge, condom use, and other factors related to risk behaviors, again, depended on the type of studies and the countries. Remember that most of these studies used non-probability convenience sampling to collect their data. There was no studies that looked on PrEP, and there was only one intervention study that aimed at HIV prevention among transgender women. As for mental health outcomes, in both sexual minority participants and gender minority participants, there were very high rates of depression, anxiety, suicidal thoughts. There were a lot of reporting of the also risks and bumpers related to these mental health outcomes, such as disclosure or non-disclosure of sexual identity, internalized homonegativity, and less comfort with one's sexual identity. Participants also reported different types of coping mechanisms. Very few talked about healthy coping mechanisms, but most of them talked about concealment of identity as a coping mechanism, social isolation, focusing on work and academia, and to really avoid other aspects of their lives, and some reported use of alcohol and drugs. Similarly, among gender minority participants, these rates were also very high, as you can see, for depression, anxiety, suicidal thoughts, or attempts. The risks and buffers were specifically related to rejection from family, poor living condition, isolation or lonely life, and high levels of resilience. There was one intervention study that looked at improving quality of life as a proxy to mental health among transgender individuals. There were also high rates of violence and discrimination. These were sexual violence, verbal or physical, a lot of reporting of abuse by police and government. In Lebanon, there were several studies also that looked at foreign-born men who have sex with men specifically, especially post-Syrian war with the influx of Syrian refugees in Lebanon. There has been more visibility of displaced Syrian LGBT individuals, and the participants who were Syrian reported higher rates of violence and discrimination than those who were born in Lebanon. Similarly, among gender minority participants, different forms of sexual assaults that even started as early as age of 12 and rates of psychological, physical, and sexual assaults from family, work, law enforcement, and healthcare providers. And these were associated with suicidal ideation, substance use, and engaging in sex work. As for the experiences of LGBT individuals with the healthcare system, there was a lot of anticipation of being discriminated against, but also a reporting of experiences of discrimination. And participants talked about for LGBT, for a provider to be affirming, they expected them to be inclusive, respectful, and knowledgeable of their different aspects of their identities and lived experiences. The studies that focus on gender identity look specifically at like the different aspects of gender identity among transgender individuals, looked at gender roles, affirming treatments, and also quality of life. So we identified several gaps and limitations in this in the research that we were able to review. The first one was the country representation. So as I mentioned, 88 out of the 98 studies were conducted in either Lebanon, Iran, or Pakistan. In Lebanon, for example, out of the 33 studies, 23 studies were conducted specifically with men who have sex with men. Whereas in Iran and Pakistan, most of the studies were conducted with transgender, or a different term used in Pakistan, specifically Hijra participants. Another gap was the representation and measurement of SGM identities. So only one study exclusively included sexual minority women. There were 5 other studies that had lesbian, gay, bisexual participants, but they did not disaggregate data. There were only 10 studies with transgender men. And there was a lot of conflation of those sexual risk categories between men who have sex with men and transgender women. And this is also very commonly seen in literature globally, and not just in the reviews that we did. Most studies were quantitative. There were only 2 interventions, and most used non-probability sampling. And as for health outcomes, the majority looked at sexual health, and more specifically, HIV-related research. As also, our scoping review obviously had several limitations. I will only focus on 2. So the first one was that we conducted our research in scientific databases like PubMed, CINAHL, PsycInfo, that includes mostly peer-reviewed articles. So even though we included languages like, we did not exclude languages other than English. So we looked at English, French, Arabic publications. However, the fact that we only looked at peer-reviewed articles excluded a lot of the work that is being conducted in those countries. For example, the ones I am familiar with in Lebanon, by community organizations. A lot of their work is not necessarily published in scientific databases or peer-reviewed articles. However, they have been conducting a lot of work with the community and publishing the reports in different platforms that are not necessarily, that were not included in this review. So moving specifically to the case of Lebanon, and obviously there's going to be a lot of overlap between what I just presented, since a lot of the research in our scoping review represented research that was conducted in Lebanon. So I will briefly go over the historical context of Lebanon, just to give you an idea, especially for those in the audience who are not familiar with this region or specifically this country. So Lebanon is a very small country in Southwest Asia. It is almost 4 times larger than Rhode Island, which is the smallest state in the US. Up until 2010, the population size estimates have been around between 4.5 to 4.9 million. And then after 2010, and this is reflected also by the post-Syrian war and the influx of Syrian refugees into Lebanon, the estimates in year 2020 were around 6.8 million individuals. And these include citizens, refugees, as well as foreign workers. Lebanon has a very diverse religious and ethnic communities throughout the country. The official language is Arabic, however, French and English are also used very widely and commonly throughout. And because of this long historical history with immigration that I will go over in a minute, there's a very big diaspora community throughout the world of Lebanese immigrants. So there are more Lebanese living outside of Lebanon than there are in Lebanon. Some of the important milestones, and obviously this is going to be a very quick overview, just to give you an idea of why the country is right now where it is in terms of political, social, or even more specifically thinking of like the healthcare system and how it has been impacted over the last century by all of these milestones. So between the 16th and 20th century, Lebanon was part of the Ottoman Empire. It was then occupied by France in 1920. We got our independence in 1943. In 1948, the Arab-Israeli War erupted and affected the whole region in so many different levels. That contributed to the influx of Palestinian refugees to Lebanon. Then in 1975 to 1990, the Lebanese Civil War erupted, which was based on a lot of complicated aspects, including religious sectarian conflicts, the Syrian and the Israeli invasion of Lebanon. In 1990, Israel withdrew from the south of Lebanon, and Syria withdrew in 2005. In 2006, there was another war happening between Lebanon and Israel. In 2011, the Arab Spring started with the most impactful event happening with the Syrian war in 2011 that had over 1.5 million refugees and displaced Syrians coming to Lebanon. In August 2020, so more recently, one of the biggest explosions happened in the Beirut port that had more than 300 deaths, as well as 7,000 or more injuries, including a lot of homeless and a high property damage. In 2019, there were protests, civil unrest, and a severe economic collapse that continues until today, on top of the pandemic that started in 2020. So, based on all of these background information, Lebanon is really a very fragile country in terms of its political aspect, in terms of the social, economic, or financial aspect. That's all of them contribute to also a very fragile healthcare system that we are still seeing today affecting the lives of many individuals. And obviously, when all of these events are taking place and happening, whether in Lebanon or in the region around it, LGBTQ rights, laws, and practices are also affected in so many different aspects. So Lebanon specifically is seen as a unique or unusual case in the Arab world because it is one of the few Arab countries that has experienced growing advocacy in terms of visibility of the LGBTQ rights in the past few decades, and also research around LGBT health as well. And this runs in a way counter to the religious, social, or legal conservatism that still prevails and drives a very anti-LGBTQ climate. So this is, for example, a recent article that was published around the representations of LGBTQ individuals in the media. So really showing how social norms depicts the LGBTQ community in a very sarcastic, problematic way, and inaccurate and biased depiction of the community. And this again influences the society's views of this population and increases the experiences of stigma and discrimination and violence. On the legal level, as I mentioned, Article 534 of the legal code is used to prosecute, criminalize, and intimidate LGBTQ identities, but it's mostly affects vulnerable groups, specifically transgender women, and more recently in the past decade, displaced Syrian queer people. So even though it is not consistently used, but it is used enough to affect vulnerable individuals specifically. And until 2012, anal examinations by forensic doctors to prove anal sex or to prove someone is gay have been used, especially when individuals were being arrested based on Article 534 and put in jail. Similarly, we see experiences being reported around sexual orientation and gender identity change efforts or conversion therapies among healthcare providers, including psychiatrists, psychologists, as well as religious figures. So this also has been coinciding with, as I mentioned, an increasing advocacy around LGBT health. And in the past 2 decades, we have seen really a big movements in different social organizations around the visibility of LGBT individuals, LGBT rights and advocacy, conducted from the grassroots, from the communities in Lebanon working towards these advocacy issues. They are working on making sure that there's appropriate representations of the LGBTQ identities in Lebanon that have in common, but also are very unique to the dominant narrative of what LGBTQ identities should look like or need to look like from a very Western perspective. So a lot of the work that is being done in Lebanon is really based on these grassroots organizations that have done the majority of what we are nowadays seeing in terms of movements towards rights and advocacy. And these are the names of very few organizations. There are more that have been working in the last 2 decades around these topics. Helen, for example, is one of the first organizations that was started around 2001 in these areas of providing legal support to more social support. Similarly, Nasawiya, the Feminist Collective. Marsa is a sexual health clinic that mostly provides sexual health services to the LGBTQ community. And a few others, including more recently, our work with LAMASH, the Lebanese Medical Association with Sexual Health, but also other associations in the healthcare fields like the Lebanese Psychiatric Society. We've seen more social networks develop throughout the country, but more specifically located in Beirut, the capital, specifically things looking like clubs or bars or community spaces that are trying to be safe spaces for the community to organize and to support each other. And obviously an increasing number of research that is conducted in Lebanon compared to the Arab world. And I think the ability to do this research with less challenges compared to the other Arab countries is because of all the work that these community organizations have been doing for the last 2 decades. So there is a lot of impact of these social movements, but I'm going to focus specifically on like the health-related impacts that these social movements have really helped with. For example, in 2012, the Lebanese Order of Physicians issued a statement to ban the practice of anal examinations. So now these are completely banned, and physicians are not allowed to perform any of these practices. In 2013, the Lebanese Psychiatric Society and psychological associations also issued statements that homosexuality is not a mental disorder, conversion therapies should be banned as well and should not be practiced. However, they are still practiced but these two societies are putting together now more formal processes into identifying healthcare providers that engage with these practices and what other consequences could happen. In 2015, the Court of Appeals in Lebanon ruled for the first time that a transgender man who had undergone affirming surgeries had the right to change his gender identity on official papers. Similarly, in 2018, also for the first time, the Court of Appeal ruled that homosexuality is not a crime, which really is against what Article 534 depicts. And it was the first time that a judge rules against this article in terms of someone being arrested under this article for being gay. There's still wide movements across all these different social movements to abolish this article. However, it still exists until today. So in terms of LGBTQ health specifically, I have mentioned that a lot of the studies that I presented on in the scoping review came from research conducted in Lebanon. But again, similar to what we saw in the scoping review, a lot of the research done in Lebanon is done with men who have sex with men, especially around sexual health. So a lot of research done on HIV prevention, sexual risk behaviors, but also some research on stigma and its impact on psychological well-being. And we see more mental health related research with transgender populations, specifically transgender women. So there is also this difference in, or this gap in really understanding like other aspects of health-related outcomes within these populations, other than sexual health among men who have sex with men or mental health among transgender women. So I will talk about some of the studies that looked at mental health and stigma in men who have sex with men. Mostly, a lot of studies are qualitative in nature. So the first one that I'm citing here by Wagner and colleagues, they really looked at psychological well-being. And it was mostly described in terms of like relationships, described in terms of disclosing one's sexual orientation or identity to family, friends, and coworkers, and how that impacted someone's psychological well-being. Participants also talked a lot about the different forms of stigma that were experienced at home, like parents being ashamed of their son's sexual orientation, in the workplace, like being denied some work opportunities, or at schools when they're constantly hearing jokes about being gay that really negatively impacted their self-esteem and their mental health. Coping mechanisms were in different forms, such as identity concealment, social isolation, and similarly to what I presented earlier, the use of alcohol and other substances. These findings are also supported in another recent study that was quantitative in nature, where around 41% of MSM reported depressed mood and 33% reported suicidal ideations. And factors that were associated with major depression were unemployment, discrimination, internalized homophobia, and lack of support. In another study, participants identified the importance of like safe spaces for their mental health. So finding other men who have sex with men, finding other support systems, some of the challenges even within the LGBTQ community to find the support that they need for safety and adequate mental health. So also, I would like to talk about how displacement, specifically among refugees, and more recently with the Syrian displaced individuals coming to Lebanon, also is another intersection of minority stress that impacts individuals differently. So it is considered as a structural stressors, and the way its intersection with other different minority identities on mental health is not really well documented. So as I mentioned, there's been more than 1.5 million Syrians who fled Lebanon. And there's been a lot of research showing that among displaced Syrians in Lebanon, they face a lot of social, legal, and healthcare challenges like discrimination, lack of access to healthcare, to education, and to employment. And specifically among displaced MSM, these stressors are combined with their sexual minority stressors, and they lead to additional forms of social, economic discrimination and abuse. And so one recent study that I have been involved in, we interviewed 25 men who have sex with men, 12 were displaced Syrians, and 13 were Lebanese, looking at their experiences of stigma, mental health, and coping. And so there were obviously some common stressors between the Lebanese and Syrian men who have sex with men, like financial, especially with the economic situation in Lebanon. But also there were some unique stressors that were specific to the displaced Syrian MSM, such as stressors related to the Syrian civil war, unique financial stressors because of their either refugee status or their undocumented status in Lebanon that did not allow them any work or educational opportunities. And there were also common and unique coping strategies that were used by the different participants. So these are a few quotes from the participants around these stressors. Some of the common stressors, like I mentioned, this is a Lebanese participant, and he said, I'm currently going through a difficult psychological period because of the general situation in the country and the financial situation, which is the biggest stress in my life. The other pressure is the least impact on me currently, and it is related to my ability to live my life openly as gay in peace. And I know that this is impossible in Lebanon. Another Syrian participant said, the stressors in my life are financial, lack of work, and emotional. I worry about leaving my partner behind when I travel. I don't want to ruin his life. He has a family. My life is hidden from my family and many other people. I don't live freely and I don't feel comfortable here. I try to forget a bit because overthinking might lead to suicide. These quotes reflect more of these unique or specific stressors that were experienced by displaced Syrians. My parents didn't want me to join the army, so I had to run away. I entered illegally to Lebanon. So a lot of participants also talked about how with the eruption of the war in Syria, how that pushed them to travel to Lebanon to either avoid the war or to avoid joining the army. Another participant said, being Syrian, the Lebanese treat me in an inferior way. Even my customers, when I ask for a specific price, this participant was a sex worker. The answer is, you are Syrian, a small amount is enough for you. There is an inferior look for the Syrians basically, and being gay and sex worker, the stigma becomes 3 times. Sometimes even when I get to know someone and he knows that I am Syrian, his direct question is, you are Syrian, which means that you are a sex worker. As for the coping strategies, these participants, so the first one is Lebanese. He said, I'm a person, I do not like to talk about my problems and the pressures of my life with others. So I used to try to solve my problems by myself, by going out, drinking, having sex. The other participant, the Syrian participant said, we used to benefit from free mental health sessions in other NGOs or non-governmental organizations, and they were very beneficial to me. I now know how to cope with stressors in my life and how to deal with them, and it makes me better. So both Syrian and Lebanese participants talked about several unhealthy coping mechanisms, to say that. And then they also talked about some of the healthy or adaptive coping mechanisms that they use. Specifically, Syrian participants talked a lot about accessing mental health services from non-governmental organizations. And this was specifically because of for those whose status was a refugee, they were provided with free mental health care through specific organizations. But these were limited to some sessions. And after that, they were not able to afford any mental health access anymore. The Lebanese participants talked about the unaffordability of mental health in general, because these were not covered by health insurance, so it was really hard to access any mental health care services. So moving a little bit more to the work I have been doing with the Lebanese Medical Association for Sexual Health. This organization, as I said, is more new, is newer than all of the other organizations that have been working for almost 2 decades now. It was founded in 2012, and we function as an executive board member that is made of interdisciplinary healthcare providers. So we're nurses, psychologists, social workers, women's health practitioners. We also have staff, volunteers, and advisory boards that work consistently with us. And we focus specifically on research, education, and policy changes. And our main target population that we want to reach is healthcare providers and healthcare systems. But we also work to provide research, education, and policy for the general public as well. We have done a lot of projects, whether they were like research-based or more community projects over the past 10 years. However, I'm going to highlight some of the very few projects that we did, just to give you an idea of the kind of work that community organizations in Lebanon are also involved in. So in response to a lot of the challenges faced by the LGBT community in Lebanon in receiving affirming and inclusive healthcare, we developed a directory that we called Lab Guide that contains a list of healthcare providers that are considered affirming and inclusive. And so to develop this directory, it was the outcome of a year-long project and consisted of 3 phases, consecutive research studies. The first one was a qualitative study where we interviewed LGBT individuals about their experiences with the healthcare system and what they are looking for in affirming and inclusive healthcare providers. It was followed up by a quantitative study that examined the attitudes and behaviors of healthcare providers. And then a third study that was qualitative that looked at interviewing and talking to healthcare providers about their practices when working with LGBTQ patients. And so briefly, I'm only going to give some findings from the first qualitative study. So the experiences of LGBT individuals with the healthcare system. So some of the themes that came up were, as I mentioned, anticipation of discrimination, which prevented a lot of participants from accessing healthcare because of the fear of they might experience discrimination. And then actual experiences of discrimination within the healthcare system and by providers. Transgender participants had very unique experiences that were related to their also gender identity, their gender expression, and how these were perceived within the healthcare system, what they expected from LGBTQ affirming providers. And they most importantly talked really about the roles of community-based organizations in providing the care that they think is appropriate for themselves. So this is a quote from one participant. She said, "I've never felt safe to go to any obstetric gynecologist before because of several issues. The fact that I was sexually active, I felt that maybe if I go to any OBGYN, they would judge me for this. And the fact that I had in the past male partners and that now I have women partners. So that was mainly why I didn't want to go." This other participant said, "I don't trust the professionals or doctors. I've had therapists, me and my friends, blurred things to our parents. That has been breached on multiple occasions." So a lot of experiences with breach of confidentiality, participants telling their therapists or their providers about their either sexual orientation or gender identity, and providers reporting these back to their families. I told him about homosexuality, so he replied that this thing you can change, which made me very upset. The psychiatrist said, "I wish you can just change your orientation And if you don't want to, it's better not to talk about it in public because it is not acceptable in Lebanon. So I wish you can find a good girl. So again, this reflects the experiences with conversion therapies or sexual orientation change efforts that is happening. As for expectations from affirming providers, I guess they should be somehow trained in order to be more accepting and understand the gay culture, to understand the LGBT community, to understand the difference between sexual orientation and gender identity, to understand that it's a very thin line between them, but they are completely different things. I mean, not to judge a person for being gay. This is not a very clear screenshot, I'm sorry. This is just like a screenshot from our website of this lab guide directory. So individuals can go to the directory. They can choose the specialty that they are looking for, the area in Lebanon that they are located in. And if they're lucky, they will find what they need. It is a living, dynamic guide that we're increasing over the time. We have several procedures in place to add new providers to the list. And there's also a way to evaluate or provide feedback by the LGBT community if they ever go to these providers and really provide feedback on what they needed. Other ongoing research that we are involved in, another project that we are calling Lab Care. And this is really to generate a better understanding of these conversion therapy practices that are happening around the country by documenting them from the experiences, like the lived experiences of the LGBTQ community. So we are conducting quantitative phase and a qualitative phase to hear the stories and experiences of individuals who have experienced these practices. In the second phase, after we finish that first phase, we will be developing competency trainings, policy advocacy, and public education that are informed by the experiences of the community from the first phase of the project. So we are looking to provide these trainings to multiple stakeholders, including within the school system, so teachers, with also religious figures, policy sectors, legal sectors as well. So we have a community advisory board that is working with us on developing all of these different aspects of this project. And finally, the last portion of this project will be to develop a series of videos and podcasts to show the experiences of the LGBT community with these practices. So some of the other ongoing activities that we do constantly throughout the year are trainings to healthcare providers and students. And more recently, we have been asked to provide trainings to different companies or institutions, especially to their human resources around LGBT health. We have also been involved with different hospitals, universities to establish anti-LGBTQ workplace discrimination policies. And we have also in the past translated and published the World Professional Association on Transgender Health, or the WPATH, Standards of Care to Arabic. This is one of our national campaigns that happened several before the pandemic. It was supposed to be a campaign that's going to go on billboard across the country. However, it was banned. So it was shifted to more online presence. We had a lot of interviews on TVs, radios to talk about it. So it really got a lot of attention after the ban happened. So we were not able to post these posters publicly on the highways or streets, but we were all able to talk about these issues in other different medias. We have created also in the past a lot of educational videos related to sexual orientation. This is the video on the left. It really shows family dynamics around a guy disclosing his sexual identity to his parents, The video on the right is more related to gender identity and the understanding of what that is. During the pandemic, we did a big social media campaign to really support the LGBTQ community during lockdown, especially because a lot of the LGBT individuals in Lebanon still live with their families. So that was an additional stressor for them to be within these spaces all the time when a lot of them don't necessarily feel safe to be who they genuinely are. And we also developed a video during the pandemic called Home Not Alone, that talked about the experiences of LGBT individuals during the pandemic specifically. After the Beirut explosion, there was a huge humanitarian crisis, especially that I mentioned earlier. Beirut contains most of the safe spaces for LGBT individuals. So most of the organizations, most of the social networking, the restaurants, the clubs, the venues that are considered safe are mostly located in Beirut. And after the explosion, all of these were affected in so many different levels. So we collaborated with a lot of other NGOs to really address the damage happening post the explosion, but also the impact of the pandemic and the economic collapse. So we were providing foods, health services, medications, and also rental support and cash to individuals in needs. This project that we are still working on, it's almost complete, is a project where we mapped LGBT resources that are affirming and inclusive. So we conducted surveys and again, validation of some of the identified resources to put together on our website a list of different organizations that we labeled as either life enhancing, like coffee shops, nightclubs, bookshops, dining areas, restaurants, that individuals have reported from the community that these are safe spaces for the LGBT community to be in. We also have a separate list that is more life-saving directory that looks more at services provided by like health clinics, community relief areas, mental health support. So different types of organizations that are also reported as safe spaces for the LGBT community in Lebanon. Again, we have a lot of other activities. On a yearly basis, we do something called Break the Silence competition, where we invite students from any discipline to submit papers that are related to any topic on LGBT issues, so whether social or health issues or legal issues. And we provide cash prizes to the top 3 papers. Every year, we also have an LGBT Health Week. Before the pandemic, it used to be an in-person, one-week events, one-day conference, as well as other events spread throughout the week. Since the pandemic, all of these activities has shifted to online. We also work on providing, on a yearly basis, LGBT Health Equity Award to either an individual or an organization that have worked to promote LGBT health or advocacy in the country. We do a lot of work on securing funds, so writing proposals, whether from foundations or different embassies in Lebanon to support the projects that we do. But also we do a lot of fundraising to sustain our staff and our organization on a continuous basis. So in 2017, we received LGBT Health Achievement Award from GLAMA, which is the Gay Lesbian Medical Association. And it was a big thing for us to be recognized also on an international level for the work that we have been doing around LGBT health in Lebanon. And on this note, I will finish my presentation. So thank you so much. And I hope there is still time for questions.
Thank you, Dr. Abboud. This is great. Yes, we do have a couple minutes for some questions. If folks want to post their questions in the chat, we can read it out, or if you would like to be unmuted, you can also indicate that and we can give you the option to speak. Or raise your hand. Okay. All right, go ahead, Mary.
Hi there. I just wanted to say that it appears that the chat is disabled.
Okay. All right, do you have a question? If anyone has questions, please indicate by raising your hand and we'll ask you to unmute and speak. Amanda, please go ahead.
Hi, thanks, Dr. Abboud. That was great. I'm glad I was able to hear this and hear about some of the more recent work you've been doing. I was wondering if you'd be able to speak a little bit to, I know you talked about the results of the study 1 that you did with the individuals. But I was wondering if you could talk a little bit about your findings from study 2, which sounds like it was a quantitative study with the providers, and what you found when you engage with the providers themselves.
Yes, thank you, Amanda. It's nice to see you again or hear you.
Yeah.
So yeah, we also have published those findings in a separate paper, specifically reporting on the quantitative findings. So there was a good, mostly like positive attitudes, beliefs around and practices around what most of these healthcare providers considered to be LGBT inclusive or affirming care that they provided to their patients. So there was a more positive approach among mental health care providers than the general healthcare providers. And when we compared our findings, even though we did not use the same tools, to a research that was done 10 years ago, also looking at attitudes of healthcare providers towards the care that they provide to LGBT patients, there were definitely a significant improvement in the attitudes that were seen 10 years ago than what has been seen now. So questions around, first of all, like their understanding of the ideas of identities around sexuality, gender, to the type of care that they provide, to confidentiality issues, to respecting and affirming people's pronouns or gender identities. So these were some of the questions on the surveys. And so these questions were informed a lot by the qualitative phase that we did. And then we had some like red flags question where if a participant, their score showed like negative attitudes, they were not followed up with to be involved in the third phase. Those who showed a more positive attitude, beliefs, practices were followed up or for a more in-depth qualitative interview to really talk about what are their actual practices and beliefs when they think of affirming LGBT care that they provide. And so again, working with our community advisory board of LGBT individuals, we put together this interview guide that helped us identify who would be healthcare providers that we would add to our LabGuide directory. And obviously there's nothing like perfect, and that's why we created this evaluation system on our website, so people who go and seek care from some of these providers also have the option to anonymously provide feedback about the care that they received. And so as we work more with the community in Lebanon, we are getting, we're working on increasing the number of providers on this directory.
Great, thank you so much.
You're welcome.
Any more questions or comments to our speaker? I actually have a question, Dr. Abboud. I was wondering whether or not you can speak to, have you gotten any feedback regarding some of the online resources that you guys have posted in terms of people's reaction to the information, or having visited some of the actual establishments that have been posted, you know, how useful that was for them and stuff like that? Can you speak to that at all?
So, yes, somewhat. This is a more recent thing that we are finalizing this list. It was based on like a scoring system. So we first got feedback from LGBT individuals within the community about what are your safe spaces, who are the providers you go to, and they provided names. And then these were vetted again within the LGBTQ community. How many mentioned the same spaces, how many mentioned the same physicians, healthcare providers. And then we provided another survey to these entities, whether it was a restaurant or a bookshop or a healthcare provider, asking them about, again, their practices that they do to ensure that their space is affirming and inclusive. And there was a scoring guide that was put together with our community advisory board to help identify like the places that were considered affirming and inclusive. We have not yet had like any official like feedback on whether these are experiences within these places. Some of these places have requested trainings for their staff, and LabMash and other organizations, we've collaborated to provide certain trainings, and they have been posting like signs on their doors that this establishment is an inclusive space for LGBT individuals. Others were explicit in saying that they did not want to be posted on our website. So even though they were considered inclusive by the community. So we're still working on this, trying to get more feedback about these different spaces. Yeah.
Good, thank you very much. There is a hand raised. Julia Gova?
Yes, thank you very much, Dr. Abboud. It was a really wonderful presentation, and it was very nice to see approach that has been tasted in the local context by somebody who knows the culture is very critical. I have a very general question, and I apologize that it's very general. I come from a country where homosexuality or being gay, lesbian is not only criminal, but really life-threatening and hostile. That it's politically, religious-wise, socially unacceptable, and you can't come out if you are gay or any other sexual orientation. So there was a meeting that was supposed to happen back about a couple of years ago, just to raise a conversation, but there was a really huge outcry and protests including by high level politically and religious, so it did not happen. So because the belief is that this is something that's imported from the West. So with this context, where would you advise that one who is interested would start? Because I do provide that care here in Chicago. It really is a very painful for me, and I've started some conversation in the training of providers that I'm involved in Ethiopia, particularly residents. And it's the same in Uganda where I work. And I just, I'm a clinician and a public health person as well, but I would like to hear what your thoughts are. Thank you very much. And congratulations. It's a fantastic work that you're doing.
Thank you so much for your feedback. Yes, this is a very tough question to answer, but so I wouldn't be able to do the work I'm doing now without the work that has been done by grassroots social movements within Lebanon. They really opened the way to addressing a lot of the challenges that we are seeing in other neighboring countries that even for research purposes, it's hard to conduct any work given, and then thinking of other types of advocacy work falls under these same challenges as well. So definitely, I think these changes and these movements need to happen on the ground within the country. There's, I mean, I talked about a lot of the positive things that we have been doing, but there's obviously still a lot of challenges. There are so many events that have been canceled in Lebanon, whether by the organization I work with or other organizations, banning of individuals from attending events, banning of any online presence, sometimes social media presence. So there's, you move one step forward and then you move 10 steps backward, and that's, I feel like, the case. I started being more and more involved with the LGBT community after I moved to the US, that's for sure. But again, I don't want to take any credit to the work that the community organizations have done on the grassroots level. So even though these might be already existing in your country, but they might be now just underground, there might be some opportunities in the future where these movements can go above ground and make some difference. But I think it just, the context that you're living in is a major contributing factor to how fast you can move with what you want to do.
Thank you.
Welcome.
I think we have a moment for just one more question or comment. Amanda, your hand is still up, but I assume that was from your previous engagement.
Oh, yes, sorry.
That's all right, good. But I think maybe just to build up, oh, let's see, is there another person? Donald, please go ahead. Donald Ziegler. Donald, you can go ahead, yes.
Okay, a wonderful work and important work you're doing. I know that the psychiatric community has now said no to the conversion therapy. The conversion therapy, is that more common and more pushed by the Christian community or the Muslim community in Lebanon?
Both. I mean, we don't have if you're asking for some data or as evidence to support this. We are in this current project that we are going to be talking to individuals about their experiences. We have questions asking them about who are the people who pushed you to go through conversion therapies. But from our previous research that were done with the community, but they were not focused necessarily on conversion therapies, the experiences have been from religious figures, whether Christians or Muslims, both.
Okay, thank you very much. Well, once again, we want to thank Dr. Sarah Abboud for her time today to present her great work that she's doing in Lebanon and throughout the region. A reminder to folks, our next talk is going to be on March 1st, Wednesday at 12 p.m. Also, if you'd like to catch a copy or a recording of this actual presentation, it will also be posted on our UIC College of Nursing website, YouTube website. So once again, thank you everyone for participating. And do check us back in about a month for our next speaker.
Thank you so much.
All right, thanks.